Balancing full-time work and taking care of school-age kids during the pandemic pushed two Western Washington moms to a breaking point. One of them was so burned out she went on leave. The other changed jobs. This morning they're sharing their battles with depression, hoping other moms will speak up and get help. King 5's Farah Jadner reports on our special series, Working Moms, Burnout or Balance.
I felt like I should be able to do both, but I couldn't.
Kelsey Burcho breaking down as she looks back on her breaking point in the COVID-19 pandemic. She's a nurse in Renton working long hours. She's also a wife and mom of two, trying to do it all.
I was so sorry. I was so caught up with the pandemic and with work, and every day was so stressful.
Kelsey's been a nurse for 15 years, but the pandemic piled on stress she didn't know was possible. She tells us there was a moment in late January where trying to balance being mom on a day off turned into a dark day.
I wished I was dead, or that something would happen and I would die, but that I wouldn't have to be the one to do it. What I learned later was that I was passively suicidal.
Kelsey openly shares her story while she continues counseling, and she just returned to work after going on leave, something her therapist said was a must. She says her family and husband of 17 years have been a loving lifeline. Like Kelsey, Kent working mom Rasmi Smith said she too was burned out, teaching elementary school virtually from her classroom during the pandemic while trying to balance being mom took a toll.
I was drained every morning, and I realized when I was sitting in the parking lot where I just did not want to come into work.
After 10 years of teaching, she stepped away mid-fall of last year, and in December, Rasmi started a new remote job as an educational instructional designer. She says it's the best decision she could have made.
I came from such a toxic mental health environment in my career and my job to where now I feel supported.
Rasmi has regular therapy and uses learned coping skills for anxiety and depression. Her love of swing dancing remains her go-to to feel good.
And that really, really has lended into supporting my mental health, where I get to feel and thrive in my individuality.
Rasmi tells us it's important to make mental health a priority and to talk about it. Kelsey Burcho agrees. As a healthcare professional, she wants other working moms to know there's no shame in depression or anxiety and admitting you need help.
I kept thinking, I can hold it together, I can do it, I can make it. And I forced myself to do that for a long time until I finally broke. And so I would tell other moms, don't wait until you break.
And we really want to thank both Kelsey and Rasmi for sharing their stories. They said they wanted to share their mental health journeys only to help other working moms out there who may need to speak up and get some help. If you need help immediately and need to talk to someone, we have the National Suicide Prevention Lifeline right here for you. That number is 800-273-8255. If you're looking for all the resources we have shared with you all week on Working Moms, Burnout or Balance, text the word MOMS to 206-448-4545 and we'll send you that link directly to your phone, and that way you can have it and share it with others as well. Farah Jadner, King 5 News.